The second special recognition award goes to Natividad Medical Center for their entry, meeting underserved and vulnerable populations where they are during the COVID-19 pandemic. Congratulations. Please welcome Natividad to share more about their work.
It goes without saying that this year has been unlike any other. I'm so proud of our hospital's team and all of the other public hospitals across California that have risen to the challenge that COVID-19 has presented, particularly for the most vulnerable populations that we serve. Natividad is incredibly honored to be recognized with the 2020 CAPH SNI Quality Leaders Award. Today, you will be hearing from Dr. Erica Romero, a resident physician at Natividad who went directly into the fields to educate farm workers about COVID-19 prevention. Israel De Jesus, an interpreter with Natividad Foundation's Indigenous Interpreting Plus program, who translated our public service announcements to Triqui. And Dr. Melissa Nothnagel, Chief of Family Medicine and Program Director of Natividad Family Medicine Residency.
In Monterey County, an estimated 30,000 people speak an indigenous language from Mexico, and 47.5% of Natividad's patients self-identify as English speakers. At the beginning of the pandemic, there was an abundance of urgent information about the outbreak, but little available in Spanish and none in indigenous languages spoken in Latin America. There was also false information circulating throughout the agricultural community. At this time, many workers were not sure if the virus was real, and some thought it could be cured by home remedies, while others expressed fear and stigma around the virus. We quickly realized the need to help educate people that weren't being reached in their primary language. Our goal was to give people accurate information about COVID-19 so they could be empowered to act, receive healthcare, and prevent the spread of the disease in our community.
In partnership with Natividad Foundation's Indigenous Interpreting Plus program, we produce a series of public service announcements in Triqui, Mixteco, Zapoteco, Spanish, and English. These PSA were posted to social media and provide science-based information about COVID-19. We also talk about why it is essential to follow safety precautions and what it means to shelter in place. Natividad sent doctors and nurses directly into the fields to educate farm workers and distribute PPE. Or Indigenous Interpreting Plus interpreters have been at many of these sessions to help presenters work to understand the unique challenges each organization, individuals, and family face. Together, we came up with a solution to potential problems.
Through partnerships with Natividad Foundation's Indigenous Interpreting Plus program, the Grower Shipper Association, representing agricultural businesses throughout the Salinas Valley, our Family Medicine Residency program, and other local hospitals, we helped reach over 5,000 agricultural workers in the fields, distributed over 45,000 reusable masks, and sent educational resource guides to 50,000 households. Health disparities and social inequities put racial and ethnic minority groups at a higher risk of getting sick or dying from COVID-19. We hope Natividad's immediate action helped reduce the impact of COVID-19 in the communities we serve.
Congratulations again to Natividad.